Hi, Nick here with MedTech World. Very happy to be with Mr. Karl Farrugia. He's the CEO of the Ministry for Health here in Malta. It's a new role. How are you feeling about it?
Yeah, it's a totally new role. I've been in position now for the last 3 months, and it's quite exciting. I've been transitioning from one entity to the other during the last 24 years. I can say within primary healthcare there's a lot of work to be done. There's a lot of innovation to be introduced, and there is a lot of gluing to be done. I see primary healthcare as the former line of the healthcare system. We build up trust with patients, so we are the first port where the patient comes to our premises and we start gluing our relationship with them. How good or bad reflects on how much spillage there is on the secondary and tertiary infrastructure there. So we are the first port of call, and we need to build trust with our services and with all the provisions we can give to our patient, and with continuity of care, because when you speak about primary health care, it's not just one intervention, you go in for an operation, but it's a continuous series of operations for different specialties.
But at the primary level, this is the front face. This is the person who's going to be dealing with the patient throughout their life of
Exactly.
them and their entire family,
Yeah.
and putting them on to the specialists and onto the tertiary sector, etc., onto the rest of it, and dealing with it. It's a huge responsibility. I know it's
It
a
is.
small country, but it's a
No,
massive responsibility.
it is because obviously we have control of the whole country. We don't have other institutions apart from the private, which we work very good with because we're partners in this. And the patient transmits between the private and public sector, so we need to have handhold of information transiting from private to public. What we're trying to do, due to the lack of resources and increase in accuracy, is introducing AI. So here is the perfect forum to start making links and start changing the way we have been doing the system. We're trying to introduce our first plans to introduce AI in ophthalmic glaucoma screening and in mammo screening. With that, we would increase the accuracy, so obviously we don't have false positive or false negative that fall out of the system. And then there will be the human intervention to counter-check the results coming out of the AI. But I think it's exciting times at the moment. There's a lot of technology going around, a lot of development going around, and it all aids to have a patient-centered approach.
And from my understanding, in terms of the data and having the accuracy of the data and accessibility of the data, and to be able to provide it at price points which are lower than what we're currently facing, is the potential of AI, from what I understand,
Yeah, absolutely. In fact, data is very important, but data on its own doesn't give you anything unless it has information which we can interpret. And the information is important to be interpreted as soon as possible, because obviously, as we know, patient demographics change, physiology changes as well, so it's important we get hold of the data and the patient at the right time and the right moment to give them the optimum treatment we can give. And that would eventually be a cost saving for us in terms of health ministry, because once we manage to capture and treat the patient at the primary level, it doesn't need to go to secondary and tertiary, which are much higher cost.
We're lucky here to have an amazing conference like this. Do you think, would you like to invite the CEOs of Ministry from Health outside of Malta, around the world? Is this a place they should be going to?
Yes, absolutely. We are all keen in having connection with the outer world and connecting between us and the rest of the European countries and even beyond that. So it's an experience that it will change the way treatment is given across the globe, not just in Malta. So we believe that data and technology need to work side by side for the patient, and it needs to be accessible and comparable between countries. We need to be innovative, we need to stretch out and share data, because data gives you information, and with that information, technologies can be developed. And for this, I believe it is the right time and the right moment to go on these innovative platforms.
Brilliant. Karl Farrugia, thanks for being with us today. Nicholas signing off from MedTech World.